All right. Thank you so much. Awesome.
All right. Hello, can anyone hear me?
All right. Apologies for the background noise. Please mute your mics if you're not speaking. You can put in your comments or questions in the chat session. Thank you. So at Digital Africa, we're promoting digital agenda in Africa by improving access to information and fostering community engagement. So going right into the panel session, I would invite Rashidat. Please, if you can hear me, please unmute your mic to take over from here, introduce our panelists to us, and dive right into the discussion. Thank you.
Yeah, thank you so much. Can you hear me?
Rashidat, I'm sorry, there's a lot of background noise. We can't hear you at all.
Okay, so as we wait for Rashidat to get a very conducive environment, but if you can hear me, Rashidat, just let me know if you're good to go. So I would request our panelists to give a brief introduction of themselves. Hello, Dr. Radha, can you hear me? Awesome. So you can introduce yourself to us briefly. Thank you so much.
Yes, hello everyone. Very nice to meet you, and thank you, Digital Health Africa, for having me join. My name is Radha Karnad. I am a doctor working in Kenya, and I was one of the founding team members and now lead for strategy and growth at HealthX Africa. I have lived and worked in Kenya. I grew up in India, but lived and worked in Kenya for over a decade now. And mostly in a couple of different organizations, but really looking at access and affordability for healthcare. Initially, women's health at a very innovative organization called Jacaranda Health, and subsequently as the lead for primary healthcare globally at Jupaigo, which is part of Johns Hopkins University. During COVID, we really recognized the need for more solutions on the ground, homegrown, home-based solutions and digitally based solutions to be able to get healthcare access out to communities that didn't have them. And that was the founding sort of principle for HealthX Africa. We are a primary healthcare service provider, but we are trying to do things a bit differently and go digital first. The idea being not every condition, not every situation requires you to be seen in person, but rather you can try a digital first approach, speak to a doctor over the phone, have a medical consultation over the phone, and then for the very small number that actually do need to be seen, examined in person, etc., they can move forward with that. We've seen a real shift in how people behave in accessing primary healthcare when it's offered digital first. It's often not realistic to expect people to take time off, travel, wait in queues, etc., for conditions that at the time to them seem not that important or probably will be something that they consider will pass. But when you have a digital first approach, we've seen that people still take up the service sooner, and hopefully that brings down both their healthcare costs and the long-term sequelae of their work. So really delighted to join you all and very excited for this discussion today. Thank you.
Awesome. Thank you so much for that very, very insightful introduction, and amazing work you're doing at HealthX Africa. Thank you so much for all that you do to really advance healthcare innovation in Africa.
Thank you.
So right now I would call on Zanga. Hi Zanga, can you hear me? Hello, thank you so much for joining us today. Please, can you briefly introduce yourself to us? Thank you.
Hi, to start with, thank you very much. Am I audible enough? All right. To start with, thank you very
sure. Go ahead.
Thank you very much for according me this opportunity to be among the panel. Me being on the panel will be more of learning from others than sharing what I've gone through. My name is Zanga Musakuzi. I am a pharmacist by profession here in Zambia. and also a digital advocate here in Zambia with over 15 years of experience. The advent of COVID-19 taught a lot of us, taught many countries the importance of digital health. We had seen a huge gap between people who are offering healthcare services and people who are seeking healthcare services. And this is now what has really made me to start pushing for digital health, because we saw many people are now trying to find information in the wrong places. We saw many people getting misinformed information about their health. We had seen people now trying to find routes that they can take when they got COVID, trying to find different concoction. And this was because of misinformation. And this is why I became so passionate about digital health, because I know technology will be the greatest equalizer in health here in Africa. If each and every person has got easy access to health information, then they'll have an easy way of making real informed decision about their health, about cancer, about HIV and AIDS. And this is why I'm so passionate about digital health. I've been in the pharmacy sector for 15 years, and I've seen the misconception, the misuse of medication. And I'm now trying to bring, how do I bring real information, the real correct information to the public out there? And this can only be done through digital health. So I'm excited to be here. My name is Zanga Musakuzi. I'm the CEO of Medsearch Zambia. Thank you.
Thank you so much, Zanga, for that introduction. Yeah, absolutely, you're right. Technology is going to be the equalizer in improving access to healthcare services in Africa. Thank you so much for joining us today. Now we have Mr. Yahaya. Are you on the call? If you can hear me, please, you can unmute your mic and introduce yourself. Mr. Abdulhamid, also.
Yeah, thank you very much. Good morning, maybe afternoon, those of you that are joining from different time zone, whichever one applies. So it's quite an honor to be here. The name is Abdulhamid Yahaya. Currently, I'm the Deputy Director for Global Health Informatics for eHealth Africa. In case you've not heard about us, eHealth Africa, we strengthen health systems and also respond to public health emergencies through the use of data-driven solutions and technology in general. I think we all know that there are gaps, a lot of humanitarian and healthcare problems that we have all over the world. But what we try to do is to see how we can solve those problems using technology to accelerate the achievement of those solutions or the achievements of the programmatic objectives for those particular interventions. So that's what we've been doing at EHA for over 12 years. I've been with them for like 7 years now. And over this period of time, we've done quite a lot of interesting things. We were instrumental in making Nigeria polio-free through the vaccination tracking system, which we call the VTS system or project. And we've been in the vaccine direct delivery, or you call it critical health commodity logistics or supply chain as well. And in this particular situation, we also have a solution there called the LOMIS Logistics Management Information System that we use to ensure that stock out rates are reduced and also deliveries are managed properly for critical healthcare commodities like vaccines. So because it's critical where we work, it's usually hard to reach areas, challenging areas. So you need to have this insight or data, insight into this data so that you can make decisions accordingly. Then we've been in the data management space for over a decade as well. All of the data we've harnessed, we put it on our data portal so that we call it our own way of democratizing access to data. Anyone can log in and download data, download maps. You have a lot of data there, admin boundary level information, demographic information, point of interest, mosques, churches, schools, markets. All of these informations are freely available on our portal, data portal, ehealthdataportal.org. Then you have micro planning as well. We've been involved in planning campaigns. So we have a tool also to help you plan before you go to these hard to reach, challenging areas. You can just use these tools to plan what the campaign will look like. And once you start the campaign, you have another aspect of the tool, the monitoring aspect, where you can monitor and compare how the campaign is going, especially vis-a-vis what you planned. So we've been in the disease space as well. We have a solution also called ComBot, which we developed in partnership with Dr. Cornelius. But that ComBot also helps to combat fall armyworm disease, fall armyworm disease for corn and so on. But it can be adapted, of course, for other diseases as well. Immunization data, if you've traveled to Nigeria during the COVID-19, you will have used the vaccination verification portal. We are involved. We have been charged for the optimization for like 2 years now or more. So the EMID platform, we are also involved there. And then we have our own vaccination app again, which is the Backtrack and so on. So we've worked with so many, USAID, CDC, Bill Gates Foundation, so many UNICEF, so many, we're proud and we're happy.
Okay, I don't know if we can still hear Mr. Abdulhamid, but I can't hear him at my end. All right, that was such a profound introduction into what HealthX Africa does, which I believe is a very, very important, is a very important work, right? I believe that, we all need everyone to really push the digital agenda in Africa. We need a diversified ecosystem pressing for this transformation to take place. And that is why I'm really impressed about the kind of panelists that we have on the call today. We have someone from the non-governmental field and also from the startup and sector as well. So I believe we're going to have a very robust, unique, and diversified discussion on the call today. Thank you so much. I'll hand over to Rashidat now to kick off the discussion.
Hello, is this better? No.
Yes. But
Oh,
it's still noisy. Okay, so I think Rashidat might still be in a noisy environment. So I would just like to ask a general question from our panelists.
Yeah.
How will you describe the progress of digital health in Africa in retrospect? So I'll start with Dr. Radha. If she can share a perspective about how the digital health space has really progressed. Thank you so much.
Yeah, thank you very, very much. I think, the progress has been extraordinary. When I think about where we started, when I moved to Kenya in 2013, I was very lucky to come here. We're talking now exactly 10 years later. At the time, we were super excited to have small modules of a part of our EMR that we could implement, or a certain app that we could use just on training. And now when you look at the entire spectrum, even between the panelists here, all the work that we're doing, there's no question that the progress has been just extraordinary. What's really interesting, I think, is the very strong examples coming out from across the continent on really impactful, really successful digital health services, and they're being implemented in so many different ways, right? It may be digital health solutions for different types of conditions, from the primary healthcare level up to specialist care, whether that's maternity or cancer care or elsewhere. Solutions that target different demographics. They're being built out for men or women specifically, or for children, or for the elderly or the youth. There's a lot of solutions being developed specifically on those sort of parameters, and then solutions. And I think, Mr. Yahaya spoke to this, across sort of the patient journey, whether that's from clinical service delivery, the kind of work we do right now with telemedicine, to e-pharmacy, to digital labs and digitally enabled point of care diagnostics, emergency and referral tracking systems, self-care tools that are digitally enabled and self-triage, supply chain and LMIS sort of management, and then of course financing solutions that are digitally based for health. So it's really, really extraordinary how I think the explosion of digital health across all of these different aspects of a healthcare journey, or the healthcare ecosystem. But I think the reasons are very clear, right? We live in a continent that has some of the largest disease burden in the world, some of the most severe shortages of human resource, geographic variability, and in certain parts inaccessibility, challenges with health infrastructure, and of course inadequate public systems to pay for health. And so innovation is absolutely critical for us to have any sort of impact in health. And so I think the progress, it was a necessary part of us trying to achieve universal health coverage. I think it's also very natural, given both that we're seeing such a rapid expansion and penetration of mobile phones, whether smartphone or not. There's a huge growth in that, and also a huge growth in the youth demographic. Both of those pieces together already promote more digital solutions, and health is naturally a part of that. It's from data, if I may, from Kenya. Data from last year was there was about 132% penetration of mobile phones or SIM cards. That, if you extrapolate it, means every adult has access to at least one SIM card, at least one functioning phone. Even if they don't have it themselves, someone around them has it. That is very deep penetration of a technology that you can use for healthcare. And Kenyans already use our phones consistently, whether it's for banking, whether it's for studying, communicating, shopping, socializing. In some ways, health has actually come a little bit later into the digital space compared to the other functionalities that we've already been using digital solutions for. I think the other reason that progress should be expected really is, yes, we see impact from other countries. There's evidence from longer ago around where this has worked, but also there's actual financial and economic gain to be had from using it. So there was a McKinsey report early this year, March 23. Allow me just to read something from it. They said, by expanding the use of digital health tools, African health systems can realize up to 15% efficiency gains by 2030, so in the next 7 years, and can reinvest these savings to improve health access and outcomes. These are real tangible benefits, right? So by 2030, their estimate is that this will unlock somewhere between 400 million to $2.5 billion for Kenya alone through leveraging digital health technologies better. So there's a real economic argument as well for why this progress is happening and why it's important. I think finally, and maybe most importantly, populations themselves are becoming more aware. They're more empowered in terms of their own rights when it comes to healthcare, in terms of where they can go for information. And that doesn't necessarily have to be a health provider. They can, go online and search things up. And they're looking much more at digital tools that give them control over their own healthcare journey, their own decision making, compared to traditional modalities. So at HealthX, for example, we have seen a huge uptake in our mental health services that is through digital health and teleconsultation. And when we talk to patients, the reason they're taking it up, one is it's less expensive. So we have a subscription-based service. For less than $5 a month, they can have as many mental health consultations as they need, versus when in person, it's in the range of $25 to $50 per consult. So if you need 3 or 5 or 7 consults, it's suddenly significantly more expensive. But more importantly than that, they now have control. They choose when they call. They choose who they speak to. They don't have to travel, take time off work, or even let anybody know that they're speaking to a mental health provider. And the interesting thing is they said to us, if we don't feel comfortable in a consultation, we can just hang up the phone. You can't do that when you're seeing somebody face to face. You can't just get up. Well, you can, but it's hard to get up and leave a consultation room. So it's putting, I think, the progress that we're seeing in the digital health space is also because so many of the populations we're looking to serve are becoming more empowered and choosing to take up digital health tools this way. Thank you.
Thank you so much, Dr. Radha, for that. I think you really mentioned the critical factors that actually uptake of digital. You mentioned internet, mobile penetration, and how the population are actually increasing in their digital literacy, right? And also the growing youth population. Thank you so much for pointing out those factors. So I'll ask Mr. Abdulhamid right now that, in your opinion, what role do you think that the number organizations have actually played in actually ensuring the advancement in digital health in Africa? Thank you. Hello, Mr. Abdulhamid. Can you hear me?
Yes, hello. Can you hear me now?
Yeah, yes,
Yeah.
yes, we can hear you
So
now.
I lost some few seconds. I think I did send my regrets that I will be joining from the airport because I had a flight that was rescheduled to coincide with the time. So I'm at the airport in case you do see the network is a bit patchy. So I'm not sure what stage we are. I lost some part of the conversation.
Okay. So we're talking about the progress of digital health in Africa in retrospect, like from how it was decades ago now to this point. What are the factors that contributed to this advancement? I was asking that as from the non-profit side, working with eHealth Africa. What do you think your organization has actually? How will I call it? What role do you think the organization has played, the non-profit organization has played in ensuring the advancement of digital health in Africa?
Okay, yeah, I think I
Did you
heard
get
Dr. Radha. Yes,
me?
can you hear me now? Hello?
Yes.
Yeah,
Go
so I
ahead.
think
Go ahead.
yeah. So Dr. Radha, I think the first speaker, I think she's covered that pretty well. Most of the developments we've seen in the digital space have been driven by necessity and also by convenience as well because of the penetration of mobile phones. I think she referenced that correctly. So which is super correct, super accurate. I think those are some of the drivers that have made digital health to develop in African terrain. But when you talk about, I think there are still maybe a couple of things to add to what she said, which will be, I think there's been more awareness after the COVID-19. COVID-19, we wouldn't say it's a good thing, but it also helped in a way to accelerate the adoption of digital health solutions or applications in Africa, because all of a sudden we had to invent contact tracing apps. We had to come up with digital communications because we had to track people that had COVID, how to contain the outbreak and so on. So that was very key. And then secondly, just to add to what I think maybe she might have mentioned in one way or the other, public-private partnership as well. We've been getting more used to public-private partnership. A lot of increase. We're not yet there. There's still some gap. I think in the conference I came to attend here in Akwa Ibom is part of what we talked about also during the primary healthcare meeting or conference that we had yesterday. So there's still that level of mistrust, but I think we are headed in the right direction. So there's a lot of collaboration, public-private, locally, and also with international organizations that is helping to drive some of these things. And then because of the penetration of mobile phones that we talked about, there's a lot of mobile health solutions as well. Because people lack infrastructure, they don't have the internet, most of the rural areas, underserved areas, or physically challenging area that we talk about. I think we call them the digitally disadvantaged areas. So there is a need now to bring the technology to them. So we implement technologies in mobile form and take it there so that you solve the problem, you remove that problem of infrastructural challenges that they have. And we also make sure the solutions are designed to be inclusive in the first place so that digitally challenged can also enjoy the solutions. You put in offline capabilities, you add adaptive technologies like screen readers, voice commands, so that people who are disadvantaged either digitally or physically can also have access. So that sense of inclusive design from the beginning, and then ensuring that you also put all of this adaptive feature and the rest makes the solutions more viable and feasible for the digitally challenged. So all of these have been very helpful in driving innovation in this digital health space. For the NGO specifically, what you could attribute to us will be one, advocacy and awareness, right? Policy advocacy. We're involved in so many groups, COPs, forums, hackathons, connectathons, African Digital Health Summit, Africa CDC Digital Transformation Strategy. All of this we are involved. We are helping to pass on the communication that yes, we need to shape the policy so that we'll be innovative, and we'll also take care that there is data security and privacy for data for the patients or if for the healthcare users as well. So this is one way that as NGOs we support. Sometimes we sponsor these forums. Even if we don't sponsor, we get invited. We use the platform to communicate, to kind of evangelize for these things, right? So that's what happens. I think we'll be in another conference later in the year in Zambia, and then again in the US for the Digital Health Summit as well. So research and development, funding innovations, it's been critical for NGOs, particularly us. We have innovation intervention fundings that we do every 3 months, 6 months. It's rollover. We select the best project and we sponsor. You can get up to $10,000 sponsorship in one phase. So that's what we've been doing to encourage innovative digital health solutions as well. or to encourage innovation in bringing up digital health solutions. So capacity building is also one of them, training programs, enhancing people. If people don't have the skill set, it will be difficult for them to innovate, right? So we have the eHealth Academy, we have the learning platforms, and we're also aware of many things that other NGOs are doing, and sometimes we partner with them. Women who code, there is a lot of NGOs that we partner with just to make sure that the capacity building program becomes more sustainable and more feasible. Then community engagement, we do outreaches. I think a lot of NGOs try to do community engagement to make sure people are aware of the values of digital, because you're talking about African setting where some people don't even trust digital technology. So you have to do that evangelizing that, okay, it's good, these are what the things you tend to gain XYZ and so on. Then we support implementation support. We advocate for privacy in our projects and also in other settings or platforms when we have the opportunity. We also make sure we encourage international and cross-border solutions and partnerships, because economy of scale can only be derived when you combine together. So that synergy and efficiency and cost reductions, all of those advantages, we tend to always promote that as well. And that has been key. Part of what we learned from the Africa CDC transformation strategy in Kigali. So Africa is shaping up to a single policy for the whole continent where we can have this converged meeting point. So solutions, don't bring out solutions that are not needed. Check existing solutions or repository. If you are really adding something new that adds value, then fine. If not, use existing solutions so that we can streamline these solutions to a few that are manageable and more scalable across and more useful across Africa as well. Then I think I've talked inadvertently about inclusivity as well. You make sure your solutions are inclusive, no matter how innovative the solution is. If it's not inclusive, you are going to end up taking a large portion of the population out of the that particular equation or your solution, which is not something that is helpful. So I would like to pause here so that I don't take too much time. I know there are probably a lot of more questions that will go around. So thank you once again.
Thank you so much, Mr. Abdulhamid. That was quite an insightful, submission. And I think one key thing that I really learned from your submission is that we all need the collective effort to really drive this transformation. We need to really collaborate across board. So thank you for giving us the perspective from the non-governmental organization, and that really shows that we all need to collaborate, right? And we need everyone's hands on deck to really drive this digital health transformation in Africa. And I think you pointed out something about ensuring that digital health solutions are inclusive, so that the digitally people still have access to this innovation. We're asking Zanga that as digital health initiatives continue to expand, how can this initiative address the needs of individuals in remote or undeserved areas to ensure that we achieve the universal health coverage in the nearest future? Thank you.
All right, thank you very much. And that's a profound question. I hope I'm audible. All right. So how do we now bring everyone on board? And this is what we are doing at Medsearch Zambia. We have valued three important things: partnership, working with community health workers to ensure that digital health is reached. We have to understand the level of understanding is different between people who are in the rural area, peri-urban area, and urban area. How are they able to respond to digital health is different. And this is now where we now have to collaborate with different partners, different health workers who understand this. I'll give an example of our app, the Medsearch Zambia app. So what we have done is we've collaborated with people in the community who know the needs of people in rural areas. People in the rural areas, when it comes to digital health, they only want one thing. How am I able to see a specialist who's not in the rural area? So this is now where we're partnering with local health workers who are able to go to them and explain and see the need that they need. One of the mistakes that we made as a company when we created our application and our platform is we thought the people in rural areas need the same digital platform as those in urban areas. And later on, we saw that the usage of our platform of people in the rural area was different with people in the urban area, until we now started collaborating with people in rural areas to see the need that they want, to hear from them. As much as we want digital health to go out there, we need to understand what does the community need out of all this? In what way can we bring digital health in terms of the services to them? It is not everyone that would want to see a dermatologist in the rural area. Majority of the people in the rural area are looking for communicable diseases. So what digital service can we give someone in the rural area? For someone in the urban area, they're looking for something else. And now we have to tilt our digital platform to what they need. And this is what is very important: partnership with different people. And also telemedicine. I think this has been talked about. One thing that we have seen that has been adopted by both people in the rural area and urban area is telemedicine. How is this shortening someone who's going to move 20 kilometers just to go see a doctor? So now the introduction of telehealth is helping people in the rural area. One thing that we are fortunate about here in Zambia is that we have seen internet penetration in the country moving from 45% to 65%. So now we're seeing people even in the rural area being able to make WhatsApp video call with me. Like my grandmother last night was chatting with me. It will be rain season, and we were doing a video call with her. And we now jumped on board to say, if we can use such platforms to chat, we can use telehealth now to bring that lady who is 180 kilometers away from town to talk to a doctor. And these are some of the applications now that we're adopting, and government is also adopting. Why are we adopting this? The reach goal is achieving the universal health coverage goal, not leaving anyone. And this is why I said the equalizer in health at the moment is technology. If a person who is in a rural area has got access to technology, then they've got access to health services. If they've got access to health services, then at the end of the day, we're going to achieve our universal health coverage goal. So telemedicine and partnership is what is going to help us achieve the universal health coverage goal, and the bringing up of different and supporting small health providers and health tech people on board. Thank you.
Amazing contribution. Thank you so much, Mr. Zanga, for really pointing out the fact that we need to actually approach this with a patient-focused design thinking, or let me say patient-driven design thinking methods when we are building our digital health initiative, so that we have this holistic approach to things and ensure that no one is being left behind in health innovation. So there are some questions in the chat session already, which I would really like to take, so that we can also answer the burning questions from our participants. So one of the questions is, are there a lot of challenges around the right information not being available at the right place at the right time, like patient records or patient files or blood tests or other medical context for a healthcare professional? I don't know who would like to take this. If Dr. Radha would probably like to go first, then we can take other contributions from other panelists. Thank you.
Yeah, thank you. I'm sure all of us have important inputs on this question, and I'm sure it impacts all of our work. I did actually try and answer it in the chat, but thank you, Avanti. Yes, I think it's one of the most critical challenges, certainly at the primary healthcare level, that we face. There just isn't yet good systems for continuity of information or integration of information across different health systems. Each hospital has their own system, each facility even, whether that's electronic or paper-based. Patients aren't really provided that information in a way that's manageable for them. They don't carry it with them. So when they're going between sites, they very often don't have any of it with them. So it is a huge challenge. I think it's also for us a very exciting opportunity. And in Kenya, we've been hearing the government talking a lot about a broader digital health framework and infrastructure where all of us can plug in the different pieces of data, whether public or private sector, whichever piece in a patient journey, all of that plugging into one place that allows us then the patient information to move safely and in a timely way between different providers who may be looking after patients. So yeah, it is currently a big challenge.
Interesting. Thank you so much. Mr. Abdulhamid, would you like to add anything to that?
Yes, I think it's a spin-off of that question. I also responded on the chat. It's still the same thing about interoperability, right? That's what will have given ubiquitous access to this patient data information. And what you said, Dr. Radha, is spot on. Most of these systems are existing in isolation currently. So what we do is we build our systems with global open standards in mind. All our solutions that are patient-centered are FHIR standard compliant, and also they are open EMR or open EHR compliant. So what that does is it allows for interoperability very easily, because that is built inclusively into the design of the system. So we are hoping that once, even if not Africa, maybe start more regionally or more locally as country or states in Nigeria, once we are able to adopt a single interoperability standard across all of the solutions, it will make things a lot easier, because then people who are building these healthcare solutions, whether that be it EMRs, EHRs, or patient record applications, what they need to do is to just build it on those platforms, and you can still build your own. Everybody builds his own, but it will not be in isolation now, because the fact that we all built it with FHIR or open EMR, open EHR standards that are readily interoperable, it will make all of the solutions very easy to integrate and interoperate. So that's the way we can go to get that. And I'm hoping that the CDC, Africa CDC, that's what we'll be following very closely. We hope and feel that one day we'll reach that level where they will be able to roll out particular standards and also do some kind of enforcement to force people to move to such standards. And once that is done, I think it will help this very well. But I agree that currently it's a serious, massive challenge, which is also drawing back some of the benefits we can get in healthcare. You go to Lagos, then they can access your patient data because you've moved 1,000 kilometers from where you are, which is not the ideal situation. So we are hopeful that one day that will be sorted out. Yeah.
Yeah, I totally agree with that. I believe that upon having unified, enterprise or digital health enterprise where multiple digital health intervention can actually plug into, right? I believe that would actually, I'm sorry, can you mute your mic? I don't know. All right, thank you. So I believe that would actually increase coordination, reduce redundancy, maximize health information exchange, and actually lower cost. Thank you so much for your contribution. I think the other question on the chat session is, what about the patient data protection perspective and the regulatory dimensions associated to digital solutions in the use on the continent? I don't know who would like to take that.
Yeah, I'm sure there are a lot of people. I can take that as well. Maybe I can start, and then Dr. Radha or Zanga, you can always chime in where necessary. Yeah, just be quick on that. I think it's a critical.
Yeah, no problem. You can take it.
Okay, thank you. I'll just start, then anyone can add contributions. Yeah, so I think part of the issue is data governance, right? I always start from here in any panel discussion or conference, because the first thing is you need to have a governance structure, responsible use of data to ensure that you protect the patient or the user privacy, and then data security, right? So that's always the first for me. I've had arguments back and forth that, well, we should not wait for governance because governance is not perfect. We should move on. I agree with that. But while we move on, we should not totally ignore the importance of getting good governance. Most of the countries don't have good enforceable data governance. You will see a lot of beautiful policies on paper on the websites, but they are not implemented when you move to the when you go to day-to-day activities that run. We've been involved in auditing, so we know some of these things. beautiful policies, but then implementation gaps exist. So there has to be robust data standards, data governance policies, and then enforced. Let it become the day-to-day, part of the day-to-day activities of the people. That's why I keep mentioning the Africa CDC digital transformation. They are key to driving this continentally. So instead of these disparate policies that are existing in Nigeria has its own, Ghana has its own, let's come together and get these policies that work across Africa, a continental policy. So it also means that those policies will spell out what are the robust security measures that you need to do, proper data handling techniques, when do you do pseudonymization, data declassification, third-party computing, differential privacy, all of these techniques, when do you apply them? Those things have to be very clearly spelled out in the policy, and we ensure that it is being followed. Sorry, I turned because of I'm in a conference. Sorry. Yeah. Thank you. So that's one. Then there has to be a data infrastructure and integration that supports all of these data security standards we talk about. I really love India. I've been following closely. They have a DPI, digital public infrastructure, that responded very well superbly to the COVID-19 pandemic. But that's still a challenge in Africa. We don't have proper digital public infrastructure set up, and there is no digital application that will not require digital infrastructure. It's not going to happen. So I think it's something we need to pay attention to, put out this useful or good digital public infrastructure that we can ride all our data highways, that our data can follow, and then we can subsequently implement all of our data security standards on top of those infrastructure. Then you need to train people to become more advanced. They should have advanced analytics, advanced machine learning, so that they can use that to also find out some of the security issues that can pop up. Then lastly, we should have a flexible data security policies. I've seen people that stick to policies that they did 10 years ago, be so rigid, and things have changed, right? So make sure you bring in, don't say you know everything, bring in third-party security firms. I think we also do that in spite of the fact that we have a subject matter security experts in-house, but we do engage with a lot of InfoSec, all of EC Council, a lot of security organizations, so that they can also help you. All this awareness campaign to make sure people understand the security measures. Digitalize it, don't make it this manual training. No, put them on the platform. Every week, you send the user the training that they need to do. If it's on malware, if it's on phishing, they conduct the training, and then they get scoring, which goes to their manager, and then the manager keeps track. You can tie that to promotions, tie that to remunerations, and all of these things. So let me stop there, because I know most of the panelists are also highly seasoned. You want to contribute one or two things to this as well. Thank you.
Yeah, I think you've almost said everything from my mouth. Really profound contribution. One of the challenges, I'll bring it back to Zambia. One of the challenges that we've been having, especially for us who are in the private, trying to bring digital to the public, especially to the old generation and the skeptical generation, is how safe and how secure is my data. This is health. If this was in terms of food, tourism, no, it's okay. But this is my health I'm talking about. So how safe is it? And this has been a challenge. One thing that we have tried to do as Medsearch Zambia together with the government is be transparent and assuring people to say the information that we're getting from you is this, and the information is being stored here. It is being encrypted, so that even as people are giving us information about the readings that they've been having, the tests that they've been having, as that data is coming on our platform, they are already safe to know to say, I'm able to provide this information to this company, I'm able to provide this information to this hospital, because my data is safe. I love the point that you said, we need to come together and have a platform that will be safe for everyone. We are at a stage where each and every country, each and every company is trying to encrypt data on itself. This is trying to encrypt data, and already that is providing a lot of doubt in people, because it's more like, okay, they are safe, I don't know if you're safe. If we're able to collaborate, I think through CDC, if we're able to collaborate and have one platform, that would be very safe. This will be very easy now to convince that lady in the rural area to say, whatever data we're going to get from you, it is safe and it is being stored here. This is how transparent we are. This is how your information is flowing. The barrier that we're having is uncertainty from the public. Digital health is good, but it is a matter of uncertainty. How safe is my data? And this is why I think we now have to put in more effort in telling the public how safe the data is. What encryption tools are we using to ensure to say whatever information we get from them will not be leaked out? We have to be very transparent to them. We have to find different encryption tools so that people are at peace, so that people know that their data is safe. And this is what we should be working towards too. Thank you.
Allow me, please, if you have the time to add, can I add a couple of points to this? Because I think this is one of the most, probably the most important discussions. I think I heard this week a phrase which was data is the new oil, and I've also heard data is the new gold. And I think, what that encapsulates, or what that says, is like, this is where this is what carries weight in the world today. Data is going to be how we use data is going to be absolutely critical in the future, and who holds that data, they have a lot of power. And so, people are right. I think we need to accept patients are right to be concerned about who has their data and how it's used, because hopefully we're all using it in the best possible way. But there are people who are paying for data, collecting huge amounts of data, and we don't quite always know necessarily how that's being used. So at HealthX, our approach to data, patient data, is first and foremost, what is the reason that we are gathering and storing this data? It is not data collection for the sake of it. I think we need to have moved from this time where we say, oh, data is so important, we need to gather as much as possible, to why are we collecting these data points? Why are we saving them? What is the value to not to innovation, not to just data protection for the sake of it, but innovation for what? For healthcare impact, for improved outcomes, for organizational efficiencies, whatever that might be. There needs to be a reason as to why this data is collecting, and is being collected, and we need to be thoughtful and honest about what that reason is. If we think through it in that way, and if we are honest with ourselves about why we're collecting that data, then we're probably not collecting every single data point about every patient who calls us. It's not always required or necessary. It's not always ethical, and that in line with regulations. And those regulations, I think, Dr. Yahaya, Mr. Yahaya, you mentioned, is coming out, right? In Kenya, we have the Data Protection Act now from 2019. The Digital Health Act just came out 2 weeks ago. It speaks highly to data security. Regulations are coming out. If we align those to what within our own organizations, the reasons and we are saving data, then we're going to meet much further along in saving the right data in the right place, in the right way, and sharing it equally. So at HealthX, for us, quality and continuity of care are the most important things. And therefore, when we think about what data we need for the patient, we're saving them, and we're asking those questions, and we're tracking it specifically around those 2 points of value. I've been told this is an idea called data minimization. I'm a clinician, not a data person, but I like that idea. I think it's very important. I think the other piece to say is, this is not yes, the technology side of it can be complicated. Encryption, what that means to different organizations. What does encryption mean then when we're talking about moving data around? All of that is complex. But there are also simple, practical, thoughtful things that any of us can do and should do in the same way that we would want done to our data, right? At HealthX, our physical structure is access controlled. So where we offer our telemedicine services, the CEO of our company and the CFO cannot enter. It's for clinical people only, because that's clinical information, and somebody who's non-clinical probably doesn't have a reason to be in there, either overhearing the calls or looking at the data. So there are practical things like that, structures that you can put in place, multi-factor authentication when you're logging in, firewalls. There are tools that already exist. There is guidance globally and locally to put in place. And training of our providers, and an appreciation of why, sorry, I'm hearing an echo. I'm not sure if you cannot hear it. Appreciation of why data protection is so important. Often we get asked, like, what does it matter? I'm just sending the name of somebody. on an internal email. But that matters. That patient may not want anyone to know that they're actually accessing a service at our facility. So even to that level of providers individually appreciating and being aware of the risk that they put people's data into if they don't really follow these regulations, it's absolutely critical. Thank you.
Much for that interesting and enlightening contribution. I think we all share the same sentiment that, health data governance is really important to secure storage and control access and safe transfer of health data, and also ensure that we are securing health data sharing between entities. And I think that's where the continental policy on data privacy really comes in. So I don't know if we have any other questions in the chat session, or if you'd like to unmute your mic and ask our panelists any other questions that you might have. Okay, I don't think I'm seeing a question. Or is anyone raise their hands? Okay, so quickly, do we have anyone asking any question? All right. So I would like to ask a general question as we conclude.
I think there's a few hands up actually.
Wow. Okay. Yes. Thank you. Okay, so Tayo, you're gonna meet your wife and ask her, please. Let's be straight to the point.
Good morning, everybody, and thank you very much to the panelists for the wonderful presentation and the projections given. I work in the public sector in Nigeria, Lagos, as a digital health program officer. And I realized that as much as it is a laudable intervention, acceptable, praised by people, I'm not talking about the health workers themselves. I realized that the transition from a paper-based system to a digitally controlled system is still a big challenge, in the sense that it's a form of change management. So my question will be, or my question is, what are the practical methods that probably our panelists have probably tried before to aid a better adoption or adherence to the protocols of engagement when it comes to institution or organization where there is going to be a change or there is a transition from a paper-based system to a digital system? Thank you.
Thank you so much, Tayo, for your question. So I think anyone can actually take this up. I don't know if Mr. Abdulhamid would like to go first. Then we have Dr. Radha contribute and also hear from Zanga. Thank you. Mr. Abdulhamid, can you hear me? Yeah, you're mute.
Yes, I had to mute. I'm still at the airport and it's noisy. Yeah.
Oh,
So
all right.
yeah. So I hope is it okay now?
Yes, it's okay. We can hear you.
Yes, I think that's an important question. It's something we've faced a couple of times as well, transitioning from digital to from paper-based to digital. Even though our hospital that we built, we were lucky, I think it's just 5-6 years. So we built it purely digital. So we didn't have to do any transition from paper to digital for that. But we've been involved in some other public health facilities where you need to move from a paper-based system that has been there for 30-40 years and to digital. It's fraught with many challenges. So I think, first of all, the first thing is commitment, because in one of those cases, I think eventually we had to pause midway because there wasn't commitment to complete it. You have to be very honest with the people that this is an enormous challenge. So if it's something they want to do, the governance of that institution must commit that it's a long-term project. 6 months, 1 year, 1.5, 2 years for you to fully move from paper. And sometimes, more often than not, you have to keep the two systems in parallel, because before you fully transition to digital, you cannot deny your patients or deny your users access to services. So there should be that commitment, high-level commitment that you extract from everybody, all of the key stakeholders. Then secondly, you have to do some assessments. Make sure you are doing an accurate and honest assessment of all existing systems. This is easier said than done. You meet a lot of bottlenecks, because people are not going to give you the information you need readily because of this protective nature. People are trying to protect their jobs, and sometimes they see you as someone coming to intrude on their existing policies.
Okay, I think Mr. Abdulhamid might be having internet issues. Okay, go ahead. Oh, let's do for a second. Thank you.
Can you hear me now? Sorry. Hello?
Yes, please go ahead.
Yeah. So make sure they
Okay, so I think Dr. Radha can take it up while we wait for Mr. Abdulhamid.
Yeah, thank you very much. I don't have that much to add. I think, Theo, from my experience with this, as a health provider myself and working with a team of providers, all of us came from, all of us had some public sector experience. All of us came from the health sector directly into this digital health space. And unfortunately or fortunately, it required really a lot of focus on training. And I mean, that was the biggest part of it. It was testing out these systems, using them again and again and again. And that's extremely challenging. Obviously, when you're delivering healthcare services at the same time. I think for me, the way we need to be doing this is developing those training systems, testing them out, making sure they're working outside of tasking public health providers to take them up. Once we know how that works and have figured out the most efficient way to train, then looking to move in. I think right now what I see very often, and this is across countries, whether in Kenya or even when I was in the UK and we were moving to an EMR, was it suddenly popped up one day and your training was happening as you're trying to care for individuals and the rest. And that's just not practical, nor do most of these trainings take into consideration how adults actually learn, sort of throwing information at you, now go and figure it out. So for me, it's about more thoughtful training, but undoubtedly that training has to happen. Can it happen in bits? I think that's where we've seen some real successes. For example, when I was at Chipaigo, introducing small modules at a time, training people in using just this functionality. Now, do you see the value? Do you end up seeing the value of it? Because then you may be more engaged and empowered and willing to take on the next piece. So not expecting a shift from paper-based to digital, or traditional healthcare models to more digitally based healthcare models overnight. Nor expecting digital to be the silver bullet and the solution on its own, but starting to think about where do small pieces of digital health fit in to the existing journey. How do we fit those in thoughtfully, recognizing that the challenges and the immense demands already on healthcare workers?
Thank you so much, Dr. Radha. Zanga, do you have any?
Yeah, I think just to add on, I think for me, we have to start very slow and not really rush. One thing that we have done is, even with the data that we are receiving at the moment, I'll give an example of the DHIS2. We are both using the digital platform and paper platform. There are some lessons that we're still learning as we go on. We had to pilot it at a certain clinic, see how data is moving, how digital is going to come in, what aspects, what should we learn and what should not learn. We should not really rush, but we should take it very easy. Just like Doka said, it is a learning, training period. So we should not rush to it. It should be something that we should start and grow gradually until we reach that time. This is the time that we need everyone to come on board. And I usually encourage young entrepreneurs, private facilities. If you're able to start building and collecting more information, there will be a time that information will be needed. So as we grow, let us try to go gradual until we reach that point. This is what has really helped Medsearch Zambia. We had to pilot it in a certain district, then later on started growing it, and people started adopting it and saying to say, look, if I'm looking for a doctor, if I'm looking for a pharmacy, this is an alternative, a platform that I can use. Trying to bring everything happening at once, from experience, it has been a backlash. So we had to do it gradually. That is my contribution.
All right. Thank you so much. I also agree with us that we have to be very systematic about how we approach, because a lot of the healthcare workers, and they are really change resistant. They are just used to the people-based system. So we really need to, get the right commitment, as Mr. Abdulhamid have mentioned, assess existing solution and see how we can incorporate the new technologies into existing new system, and also really train them, let them see the value of these platforms, right? And I believe I think we can begin to see some changes. Thank you so much. So do we have any? Okay, we have Kamau. So we'll take this last question. Kamau, if you can hear me, please unmute your mic and ask a question. Thank you.
My question is about the same issue of resistance, and I'm wondering, is there something that can be done even at medical school so that people, because you're training those people using the same old methods, and then when coming to the field, we're introducing them to a different way of working. So I was just thinking, is it possible to even maybe modify just a bit on the curriculum during the training? The training of the medical, whatever, medical team, so that when they come, it's not something new. Because I think the resistance usually comes from the bit of you're used to doing things this way, then there's a new way of doing it. So I was just thinking, would that be able to help reduce the resistance when it comes to the field when you're introducing the automation? The other question is about, is it possible to be able to categorize what can be done remotely and what might require a face-to-face, so that it becomes like a guideline for those facilities that are willing to jump into telehealth and reduce or make it much easier, just like the other industry where a number of things you can be able to do them remotely without necessarily having to visit maybe the bank and such. So just thinking, can the medical field maybe categorize those particular interaction that can be done remotely, and those ones that require a kind of face-to-face? Thank you.
Thank you. Can I can take a stab at that? It aligns exactly with the work that we're doing. Mr. Kamau, I think you're absolutely right. 100% pre-service training is absolutely critical, and I think we think of some of these things, telemedicine, etc., as foreign or not existing, but certainly in Kenya, if you talk to most doctors, they are already managing multiple patients, even if it's their own family members, across WhatsApp, or getting calls from people saying, I'm not there right now, but what can I do? This is telemedicine already. We are doing it. We just need to be doing it in a way that is structured, that is safe, and that aligns with the regulations. And I think you're absolutely right. That has to start from pre-service training onwards. I think there's a big shift towards that. We've been hearing from the Ministry of Health as they introduced the Digital Health Act in Kenya, that, there has to be elements of how you deliver a service on a video or on a voice call is completely different than how you do it in person. The questions that you ask, the level of depth that you go to, and what you can manage, as you mentioned, all of that is different. At HealthX, when we started, these regulations didn't exist. So we took the Kenyan national regulations and we sat down and we said, okay, if this is the guidance for how to manage all these primary healthcare conditions, coughs and colds, upper respiratory tract, UTIs, whatever those are, what can we manage if it's a chat-based service? What more can we do if we have a voice call? What more can we do if we have a video call? And where then what, which patients have to be referred to be seen in person or have lab tests or whatever. And we've had to map that out for our own organization. I think we're seeing that shift a lot. These guidelines exist globally from other countries, but sometimes, of course, they don't apply to a Kenyan or an African setting. But what we're seeing now is the Ministry of Health leading efforts in Kenya, for example, on establishing telemedicine standards, which will highlight not the clinical guidance, but some of this. We're then going to have to go to the next step of developing the clinical guidance that goes alongside to say, this can be managed by telemedicine, this can't. And then as providers, it falls to us to be responsible and stick to those guidelines. We tend to want to hold and walk our patients through their entire journey. Telemedicine is globally shown to serve about 80% of all primary healthcare needs, but those 20%, you can't hold on to them. They must be seen in person, or there's significant risk associated with that. So I think there is, it's about risk stratification and then guidance alongside that for what's to be done. And I hope that some of this answers the question. There was a question from Mr. Kaustav about including traditional healthcare practitioners. I think from training onwards, we're not new people delivering this service. We're people who've come from the traditional healthcare system as it stands, from brick and mortar facilities, and now delivering healthcare in new ways. So it naturally and necessarily requires their inclusion in the system.
Thank you so much, Dr. Radha, for answering that question. So as we wrap up, I would just like to ask a general question. What are the significant risks, in data-driven innovations in Africa that you've identified? And so you can just mention one risk so that we can all go around, and so you can mention a risk and also ways that we can mitigate that risk. Thank you so much. So if we can start with Mr. Zanga so that we move towards Dr. Radha. Yeah, thank you.
Okay.
Mr. Zanga, can you hear me?
Yeah, I can get you. Can you get me? Can I go on?
Yes, please go ahead. Thank you.
Can hear you.
Yes, please go ahead.
All right. I think one of the risks that we are now seeing is that I'll follow what Dr. Radha said. Digital information right now is the gold that we have. It's the new ore that we have. And the risk that is there now is that everyone is going for it. And if we are not careful, this is digital health is something that Africa needs right now. But if we do not tread very carefully, at the end of the day, it will be Africa's greatest enemy. We need to put around stringent measure to protect the data. This is what is very important. We are seeing so many startup companies, so many entrepreneurs trying to provide an easy way that people can access health information. But the greatest challenge is most of them, the information is not safe. So we'll need to tread carefully, very, very carefully, and protect this data. If not, this will be the greatest enemy that the medical health here in Africa will have. And many people will shun away. Many people, the old generation especially, will not go for it. And they would rather go to the old way of accessing information. I would rather walk 10 kilometers to go to the doctor, let him go back with my file, than leave my information on a digital platform. So the greatest risk that we have is information not being safe. We need to tread very carefully. And this is what at Medsearch Zambia, we have made about 3 encryption steps just for people to have information to that. The end user has to authorize so that any doctor can have access to that information. So this is one of the risks that we are trying to protect as Medsearch Zambia. Thank you very much.
Thank you so much for that. I think it's an important point that you've made. So I'll move to Mr. Abdulhamid now. So we can let him go take his flight. All right. If you can hear me, Mr. Abdulhamid.
I can unmute now. There's a lot of maybe let me just cycle back to me. Yes, later, yeah.
All right. Yeah, sure. All right, Dr. Radha.
Yeah, thank you very much. I think for me, the biggest risk that I foresee that we need to keep in mind as we grow and as we move forward with digital health is are we going to exacerbate any sort of inequities in healthcare through the digital solutions that we implement? Are we making sure that there's no one left behind, or are there vulnerable groups that will be left behind through the work that we're doing? Do our solutions from the start serve or actually exacerbate a digital divide that may be based on gender, it may be based on location, whether you're urban or rural, it may be based on literacy or wealth. So I think, for me, that lens on equity as most important, more important than financial success, more important than long-term gain, but equity as a part of health outcomes, and that the risks that we take sometimes in putting in these beautiful digital solutions that don't have equity at their core, that for me is a significant risk. And so I think, having conversations like this, making sure that we are including the voice of the people we're looking to serve, and consistently thinking who else is being left out of this discussion because of what we're doing right now, who else should we be including, and how do we get them to take on what we're doing, but how do we adapt our service to meet their needs and their realities? If we keep that in mind, hopefully that's a mitigating factor. Thanks.
Thank you so much for that point. I think it's really important that we include diversity, gender equality, and inclusion in our approach to, building up digital health intervention, so that these innovations are well represented and, no one is being left behind, even as we work towards achieving the universal health coverage. Thank you so much, Dr. Radha, for that important note. So is Mr. Abdulhamid able to speak now?
Yes, I would still like to pass on this one. Thanks. Yeah.
Oh, okay. Yeah. All right. So we're actually done. I think it's been a wonderful discussion, hearing from different perspectives, different stakeholders in the ecosystem. So I think it's been an insightful discussion, and I would just like to say that, as we navigate the dynamic landscape of digital health in Africa, it is clear from our discussion and conversation today that innovation and collaboration really holds the key to transforming healthcare outcomes across the continent. And from our panelists, they've really mentioned a lot about fostering partnership, public-private partnership, bringing everyone on board, prioritizing inclusivity, and addressing all of this risk that has been identified. We actually need to approach all of these things with reliance, resilience, creativity, and we can all collectively pave the way for a future where digital health plays a central role in advancing the quality and equity of healthcare in Africa. So I'd like to, on this note, appreciate all of our panelists. Thank you so much for your time, your enthusiasm, and, taking out of your busy time to really come onto this session. Thank you so much. So we'll be sharing the recording publicly. And as you know, we are still in the Digital Health Week 2023, and I hope that next year when we come back, we would have made tangible progress, and we'll be talking about, all of these things with all of the risks we've identified and challenges. I hope by next year we'll be able to talk about how we've made progress in, actually addressing all of these challenges, and we can, we can track the progress from this year to next year. So you join us next year as we also celebrate the Digital Health Week 2024. So thank you so much, everyone. Please do follow us online at Digital Health Africa. Thank you so much, Mr. Abdulhamid. You actually need a safe flight to your destination. Thank you so much. Thank you, Dr. Radha. Thank you, Mr. Zanga, for your time as well. We hope to continue this conversation, offline. And we believe that as we're back on this journey, I hope we all remain committed to leveraging the power of innovation for the betterment of health, to ensure that we have a future where everyone, regardless of their location or resources, can actually access the care and support they deserve. Thank you so much. See you next year. Bye.
Bye-bye. Thank you.
Thank you.
An HMS application.
In the heart of Africa, where the vibrant rhythms of life intertwine with a challenging healthcare landscape, a digital revolution is quietly unfolding. For decades, the continent has faced daunting healthcare hurdles, limited access to medical services, a shortage of skilled healthcare professionals, and the burden of infectious diseases. But today, the wind